Greetings. I had my surgery, so day before yesterday. It all went pretty well, pretty reasonable, as I reasonably expected it to be. I had to. Oh, I'm sorry. I'm just really wiped out from the whole thing. As I said, it was the day before yesterday. I'm actually feeling a lot better today than I was yesterday. I guess that'll be, hopefully, how it plays. But wow, I'm exhausted. The reason I said I'm going to have to shoot this in pieces is because I didn't even bother making my bed, because most likely I'm going to have to cut this short and shoot it in pieces so that I can go take naps. I'm tired. And I do a lot of walking around. I'm in a tri-level house, so well, really I don't have much reason to go to the basement. I'm just going up and down from the upper level to the main level, but in any case, I've certainly got to memorize that stair rhyme. Up with the good and down with the bad. Up with the good, down with the bad. I keep saying it over and over because, I don't know, sometimes I end up screwing it up. On the last couple stairs, I don't know why. It's an adjustment. And I'm new at this. But in any case, yep, my check-in time was at 5:30 a.m. at the University of Chicago Medical Center in Hyde Park. And, well, I ended up having to drive myself there with my husband because I don't normally allow him to drive because he cracked up our last car. But I don't know. He messed up the scheduling for the Uber ride that we were supposed to take originally. Supposedly he got it via his medical transportation, but then I asked him if he scheduled in advance, and I don't know, he wasn't able to do that. He could only schedule it for the moment, and I'm like, I have to be there at 5:30. I can't be screwing around, because a lot of the time when he goes for his dialysis, his rides are never on time. It's delayed, and I can't have that. I just wanted to get to my surgery. So I figured I'd take a chance, and, you know, I know I can get myself there on time, but depending on him, it's never assured. But I figured when he's driving home, I'll just have him go slow, only take the local ways, no expressway. And yeah, he managed to drive home, and I kept an eye on him, and it worked out. So, thank God for that. But in any case, I got to the hospital at 5:30, and they checked us in, and um, I don't know, they put me in this room and to prep me for the surgery, I guess. They hooked up the IV on my hand. Is that kind of healed up? Yeah, it's kind of red still, but pretty much healed. And then the guy put in some other kind of medication, I don't know what, but he told me, well, let me know if you get an upset stomach, if your stomach feels upset, or if you feel itchy. And maybe my head was feeling a little itchy, but I mean, not really, because there was so much going on. I was in sensory overload with the whole hospital experience to begin with. So then when they wheeled me into the surgery, one of the nurses, she's looking at me and do you feel irritated in the top of your head? And I'm like, well, it was a little itchy. And then she shows me on her cell phone that my forehead had turned all red. There was like a band of red here. And I don't know what that was. I guess it was a reaction to whatever that was that they put in the IV. So, but I didn't even notice I was having a reaction to it, really. Huh. Well, thank God they noticed, and then they gave me some Benadryl, and I guess it went away because, well, then I was knocked out, and I don't remember anything other than when I woke up. So, Then I woke up and yeah, you're all groggy and you don't know what's going on. And then there's a nurse sitting there and my husband's there and I don't know, talking, water drinking. Oh, they gave me crackers too. No appetite. I don't really have an appetite. I'm thirsty, very thirsty. That's lemonade here. Oh, very thirsty. But no, I don't have much of an appetite. But the pain, well, it was pretty severe at first. It was like my leg was not attached to my body. It felt like a foreign object and so heavy. Now it's better. It's, when I'm sitting, it gets stiff. And so it is better to move around. And I had the physical therapist and the nurse over yesterday. That went okay. I don't know. They just kind of went over my routine, what I'm doing, and whatever. And then I guess everything starts next week. I don't know. It's exhausting, really. But I'm glad I did it. And everything seems to be going pretty well, as far as I can tell. I mean, it's only one day after the surgery, or 2 days after the surgery. But I don't know. I always do pretty well with everything. I'm not really bothered by physical stuff. It's just, I have a way of ignoring it. I mean, I notice when it's important, but, I don't just focus on it. I just want to do what I want to do. And that involves moving around. So, I don't know. Oh, and yeah, I've been using my little devices, but some of them work better than others. And here's what I got. I got the walker here. This has proven to be very helpful because I only go up and down the stairs with the cane. Obviously, I can't go with the walker, but this is useful for getting me to and from the bathroom. And I've been putting my essentials, TV remote, light remotes, glasses case, water bottle, bed remote in this box because my cat has a tendency of going up on here and doing what I call her lessons in physics. She'll just knock it over, knock it over, knock it over. She loves Newtonian physics, but this prevents her from doing that. And I got my grab bar here. This has proven to be invaluable, absolutely, because I keep dropping stuff. And what else? Let me see what I got here. Hang on a minute. This thing, it helps you put your clothes on. It's got the shoe horn and it's got these grabber things. This has worked out pretty good for me. But this, oh my God, this has bothered me. This is the thing where you're supposed to grab your leg and pull it up. But look at this. When it's dark in the room, okay, I have a nightlight on still, but it's dark in here and I wear glasses and I'm not wearing them when I'm getting up to go to the bathroom or something. Look at how limpy this thing is. And I'm trying to turn it to get my foot in there. And I got to go to the bathroom, so I'm starting to feel a little desperate. This thing is a real pain in the behind, literally. Because it takes so long to get my foot hooked in there, and then I, swing it around. That part works okay, but trying to get it in this limpy hook. What a pain it is. Limpy, limpy, limpy. Then I try to get it in here, but again, it's dark in there. I don't have my glasses on. I'm having a hard time getting all situated. So, this I'd give it a, let's say 50% thumbs up. Like, it's okay. It beats nothing. Let's say that. And I tried the ice bag last night. It started to get, my hip started to feel kind of inflamed last night. So I put the ice bag on it, and that worked out pretty well. Right now, the hip feels okay. I just want to take a nap, really. That's all that I feel like doing is taking a nap. I'm tired. That takes a lot out of you having surgery. I'm 68 years old. It took a lot out of me, let me tell you. And hopefully, everything goes well. I don't get any infections. And tonight I'm going to take a bath. I would like to do that because they put all kinds of sticky stuff on my chest. I don't know, monitoring things. Just like to get cleaned up. I don't know how hard that'll be. I'm going to use and I had to redo my whole shower chair bench. I'll show you that at another time. Maybe later in this video. I don't know. I had to actually take the whole thing apart because they sent it backwards. You can fit it however which way your tub goes. And you want to have the back part against the back wall of the shower. And you want to have the bigger rubber tips in the tub. So I had to take it all apart and redo it. But it's fine now. Should work. Had a power outage the week before the surgery, so that was a little stressful. Had the power out for 2 days and 2 nights. We had a bad storm over here, and well, I don't think we had an actual tornado in my specific area, but the winds were pretty high. I think they got up as high as 70 miles per hour. So we had some tree damage in the back, and yeah, everything happens all at once, I hate that. And also the service light on my car came up. It's a Honda. It needs B1 service. That's oil change, tire rotation, and I don't know, whatever else they do. Basic maintenance. But I don't have time to schedule that. And I have to have a tree chopped down. It's like, of course, all this stuff comes up now when I'm just trying to recover from surgery. And yeah, I feel kind of doped up, They gave me all kinds of medication. Look at all this. Look at all this medication that I have. Oh my God. This is all just from this. Look at them all. I keep them in a box to help me organize myself. Oh my God. This is aspirin. These are chewable aspirins. Take 2 of those a day. That's so that I don't get a blood clot. And here's, what is this? Sulfamethoxazole, trimethoprim. Who even knows what that is? Take 1 tablet a day. Here's something for constipation. 2 tablets per day. Because the narcotics apparently clog you up, so they give you something to help you for that. And then I've got, what is this? Celebrex. 1 capsule twice daily. And we have Protonix. Don't know what that is, but I'm supposed to take 1 tablet per day. And we've got oxycodone, 5 milligram, and that's take as needed for severe pain. We've got tramadol, 50 milligram, that's for moderate pain. And we've got acetaminophen, that's Tylenol, 2 tablets by mouth every 6 hours. So that's just a maintenance one. But yeah, holy cow, that's a lot, huh? All that just from one surgery. I have to do that for, I think most of them say 14 days. Yeah, 14 days for the first couple weeks. Wow. I say wow. I mean, it's a lot when you're, the first couple days it's rough. But it seems to be healing okay. I feel better today than I did yesterday as far as moving my leg around. Because that's kind of scary when you first, you can't move your leg around. I mean, I knew that was going to happen, but when it actually happens, it's like, oh, just got real. But fortunately, yeah, I'm feeling better today. I'm moving it around. And I'll try to do some physical therapy. I got some exercises here that I don't know if you can see it, probably not, but things to do. I'll try to do those periodically throughout the day. I just want to get well and get through this whole thing. That's my whole deal. Just want to. Oh, I just heard something. That always freaks me out too because I'm a nosy one. I hear a noise. I want to go, what was that? I want to go look, but I can't go look. And the phone, I got to keep the phone on me all the time because holy cow. No sooner do I step away than it rings. Yep. And I'm going up and down the stairs and I got to remember that little rhyme. Up with the good, down with the bad. Up with the good, down with the bad. I memorized it now, yeah. Because I'm a need-to-know kind of gal. Now that I need to know it, I know it. And I figured how to get in and out of bed. I'll figure out how to get in and out of the tub. So, it's going all right. It's not too bad. I mean, it sucks. I wish I hadn't had to do it, but as an overall experience, it seems okay. And I don't feel, I used to get this extreme lower back pain. I guess that was from my hips. And I still get on the left side because I still have to have surgery on that one. But I just noticed this morning when I was brushing my teeth that I didn't feel that pain in my lower back on the right side. So, woo! So hopefully everything works out okay and I can get the second surgery done and be almost as good as new. I just want my parts to work, I'm not asking for the sun, moon, and stars. I just want my parts to work. So, anyway, that's all for now. I'm going to take a little nap, and I'll get back to you maybe later. See ya. Oh, hey there. I'm back after taking a nap. I just thought of another thing I wanted to note for you. They put these compression socks on me when I first came out of surgery. I woke up and compression socks all the way down from thigh to ankle. So that's to help me stop me from getting a blood clot. And then another thing to note was before I went into surgery, they took 2 swabs and they coated each nostril very thoroughly with iodine. And they told me that was apparently because someone had come out of surgery and, wiped their nose and got a bacterial infection. So, but boy, let me tell you, all day yesterday I was just sneezing and my nose was all snotty. I had to blow my nose incessantly because that stuff lit up my nostrils. So, but today, well, they're a little drooly, but it's somewhat better. So I guess everything negative will go away. But yeah, that's pretty much all I wanted to add. See ya.